Hi, and thanks for tuning in for Coping with the New Normal, How to Keep Moving After a Cancer Diagnosis. My name is Tommi McHugh. I have a master's degree and I'm a certified child life specialist at Children's Hospital in Colorado. I have a bachelor's from Colorado State, a master's in child life and education from Mills College. I currently work as the child life educator at Children's Colorado. And previously to that, I had 13 years on the oncology unit as the child life specialist, 2 years as the bereavement coordinator for the hospital, and then also worked in the bereavement field at hospices locally. And my child life experience also includes rehab, medical surgical units, burns, general pediatric as well. And so today we're going to be talking about the new normal after a diagnosis of cancer in your family. And the objectives for the day are for you folks to walk away with an understanding of how to manage communication within the family and with friends and family outside the home, how to promote normalization and continuity in your family and for your family, and how to promote positive coping with your children. Just as background information for folks who don't know, I wanted to just talk a little bit about the role of child life. We minimize the impact of hospitalization and chronic illness on your children. We support your family's norms and your needs. We advocate for your child and your family needs and wishes. We help all your children, patients, and siblings to understand a diagnosis and what the treatment plan is and how they'll be cared for. We help your children develop coping strategies that they can use over time that empower them to handle the challenging parts of their diagnosis and treatment. We prepare children for procedures and for treatment. We educate them on what a bone marrow biopsy is, and we talk about everything from the five senses, so what they're going to see, taste, feel, hear, and smell. And then we also help with memory making and creating a legacy. And that primarily takes place over time, but there's a larger focus of that towards end of life when we know that a child is likely to not survive their diagnosis. We create handprints, photo books, letters from siblings, from the patient and to the patient, and things like that. So what is the new normal? So this is the cheesy definition component of my presentation, where just to start the dialogue, I looked up if there was a definition for the phrase new normal, and Urban Dictionary had one, and it says the current state of being after some dramatic change has transpired, what replaces the expected, usual, and typical state after an event occurs. The new normal encourages one to deal with current situations rather than lamenting what could have been. Now, obviously, in your world, there has to be lamenting. There's a grief process that goes along with the diagnosis of cancer in a family. And there's grief for what your child has to experience, what you as parents and caregivers have to experience, what siblings have to experience, and just a loss for the normalcy that you've had until that time. So this isn't the be all end all, but I thought it was an interesting starting point for the day. So what's your new normal? Obviously, if you're tuning in, you have somebody in your family or someone that you know and care for experiencing a cancer diagnosis. And that new normal begins minutes after you first hear the words. So looking at this and thinking, what's changed in your day to day? And obviously, I know and you know that that's everything. Everything's changed. Grasping onto pieces of normalcy feels really, really difficult. But looking more specifically at what routines and rituals are needed and do you need to keep, and that might be bedtime, standards of behavior in your family so you can't hit and you say thank you even when you feel crummy. But that varies family to family for sure. But I think it's important to examine that and to ask yourself some of those questions. And then what are the things you've decided to let go of or were taken away from you that you don't have a choice in? Date nights, a clean house, setting limits on how much TV your child watches in a day, and things like that. And again, those change family to family. They change day to day depending on how your child's feeling, also depending on how, as a caregiver, you're coping and how the other kids in the family are doing. All those things weigh into that. So the new normal is a really nebulous cloud that's always changing. It's not a set thing that you nail and you figure it out within a few days. So communication is a huge component of where changes occur instantly for families with new diagnosis. So there are many levels of communication we engage in constantly that we don't even think about. We talk on the phone, we text, we email, we converse face to face with our family and friends. We have body language. So I know all of you have to have experience with the body language from your child. If it's an infant and you're overstimulating, or a situation is overstimulating, an infant's body language is to turn away and to look in a different direction. But then, as kids get older, you find eye rolls and kids helping you take your hands off of them when you want to give them a hug. So there's constant ways that we communicate. Suddenly, after a diagnosis, those change and they need a lot more focused attention. Getting accurate information out to people can and often feels like a full-time job. Who do you want to know? What information do you want out and around in the public? And how can you, as a caregiver and parent, control that? So just to think about for you is what communication levels stand out. There's communication between parents and caregivers. So different people in the family who are providing care, and that can be parent to parent. It can also be ex-partners and partners, grandparents who are caregivers, siblings who are caregivers. Between caregivers and the medical team is another obviously crucial level of communication. Between the parents and caregivers and the patient. Between parent caregivers and other children in the home and in the family, even if they live in a different home because of age or multiple homes for the family. Between parent caregivers and their support system, and that can be family, friends, church members, anybody. And then school friends, church, and anyone else who you need to have appropriate and accurate information. And that's a lot of juggling. And that is clearly, I believe, probably the understatement of the day. So there are some communication tools out there. And what tools you want to use and how you want to do this is obviously 100% an individual family choice. But it's a huge question for child life specialists. Sometimes when a diagnosis is new, or when a child's treatment plan and diagnostic information changes over time, families struggle with what information they want to share. Do they want to use the word cancer? Do they want to use the word leukemia? Do they not want to use any of those words? Child life specialists work, I keep tapping that, sorry. We work from the perspective that when you give full and accurate information, you minimize the risk of disinformation. And so obviously whatever a family feels is the best decision for them, we support, but we are believers in using the term cancer, leukemia, accurate medical terminology for diagnosis. And largely that's due to the concerns around misinformation. And there's less to juggle when you're putting out there the right words and knowing that your child has them. So we often talk about sort of the playground scenario where you choose not to use the word cancer with your child. And but other adults know, and other kids from another family down the street hear that terminology and walk up to your kiddo on the playground and say, you have cancer. And that misinformation leads to your child feeling scared and overwhelmed And also it leads to trust issues in the family sometimes and things like that. So again, we meet you wherever you are. We'll back you up wherever you are, but that's just something to think about. So generalized communication tools are things like, do you want to text or call? Which is easiest for you? A Caring Bridge website, if you guys know Caring Bridge, they are websites that are set up to use during a time of illness or injury. And they are an easy place to get all the information in one spot. A lot of our families feel very much like that's a tool that they benefit from. And a lot of our families run those Caring Bridge pages and write all the updates themselves. And other families have a family member or close friend who does the updates for them. But it's a way to get out one chunk of information all at the same time to a big group of people. And then the question of how do you minimize misinformation and gossip? And again, that looks differently for different families, but in my experience, getting out accurate information quickly helps a great deal with that. So this is a tool, and it's the 6 E's, and the first E is engage the child at the opportune time. It doesn't have to be when things take a turn for the worse, but letting your child be involved in the conversation when it's developmentally appropriate for them about what's going on and what the plan is, and both the treatment plan and their individual care plan. Kids are obviously most interested in their physical self, especially at younger ages, and so involving them in that. Now, again, Child Life can help you as a family unit decide what is the developmentally appropriate information to get to your kiddo, and we can help with that. So the next E is explore, and this is a big one. Explore what the child already knows and what they want to know about the illness. And I put there, you may be surprised, and that's really true. Very often parents have a sense of where they believe their child is, and more often than not, I would say from my experience, the kid is several steps ahead of that, and that often when you ask the child, what do you want to know, that answer is very often surprising to parents, even though obviously you're experts on your own kiddos. The next E is explain. Explain medical information according to the child's needs and age. What do you like to know? What have you been worrying about? Oftentimes, we hear a lot from kids about feeling a very concrete need to protect their parents and not to make them cry by not asking, and so they choose not to ask questions. And so that's an important thing to think about and remember that in these conversations, often your child, older children, are protecting you as well. And so you might have to dig deeper or work harder / differently at creating open channels of communication. The next E is empathize. Empathize with the child's emotional reactions. Validate and clarify. And you can never do either of those things too much. Well, you can, because we're parents and kids sometimes find us annoying. But I think it's really important to know that kids' perspectives change really quickly. And so empathizing on how difficult this is for them, and then making sure that they understand really what the next steps are and what the plan in place is helps a great deal. Encourage the child by reassuring him or her that you'll be there to listen and be supportive. This just makes a big, big difference to kiddos. Again, when they know that there's open dialogue and that that you're prepared to hear even the hard conversations, it makes a big difference to them. So another big challenge in communication is how you communicate your thoughts and wishes with others. So in patient, we often talk about putting signs on the doors, asking for whatever you need. And that might be that medically related conversations please should happen outside of this room, including conversations with parents, and being really specific. It also might be, please don't have medical conversations when the parents aren't here. Please wait for parents who will be back at 5 o'clock. Whatever you need to do. Have providers put notes and charts about your wishes for communication as well, and being really clear about what that is. And then express wishes to your nurse, both inpatient or outpatient, about what you're looking for, and finding the person who you work with most consistently to help share that message makes a big difference. And the big sort of message and lesson I've learned over time is that if you can start right off the bat with the communication stuff and be proactive rather than reactive, it's much easier. I say this with nothing but love for the medical teams, but they're often slow to change their style of communicating with a family once they feel like they have a system. And so don't be shy to speak up on day one about how you need to be communicated with and what your expectations are. If you need a daily check-in, you need a daily check-in. If you need a twice daily check-in, just as valid. If you want to be in charge of when those conversations happen and reach out as needed, just as valid. It's really important to ask your children what they want. How involved do they want to be? Do they want all the details and every change? Do they want to know their blood counts every day? Or are they more interested in just the basics? I've worked with patients who, after bone marrow transplant, want charts in front of them that show what their counts are doing every day. And I have worked with patients who have said, I don't ever want to hear my counts until you walk in my room and tell me that they're good enough for me to be discharged. And the importance of this question, it needs to be re-asked as things change, re-asked as your child's needs and developmental needs change, and really, in an ideal situation, it's an ongoing dialogue. Make sense? So ways to help your child or children cope. So oftentimes folks need to do an assessment of familiar or preferred coping behaviors. So with me, that often includes a conversation saying to parents and caregivers, how does your child behave when they're really tired? What do you do to help them? What does your child do to help calm down after a rough day? Are they a kid who likes to watch a movie or go for a walk? Do they like to talk about it? Do they not like to talk about it? We often talk about things like when they get a shot, do they like to look or look away? What's the worst pain they've ever had? So me hearing from a kiddo that they got a paper cut once that was the worst thing that ever happened is really important. Just as important as hearing from a kiddo that they had a femur fracture, they broke their leg and didn't know it for a little while. Things like that, so that we're working with them where they are. Parental involvement in coping is one of the most important things in the world. So we need to know also how you cope. What do you do when you're stressed? What do you need when you're stressed? How can we help you when you're having a rough day? Some parents really want to be present during procedures with their children, and some parents feel like their anxiety level can negatively impact their kids. And we support that, whatever it is. We like to match the coping technique with the realities and demands of the procedure. And what I mean with that is just that we're going to put in place coping strategies that are going to be effective. And so if your child likes to walk around a room and they're getting an MRI, we need to come up with a different plan because they're going to need to hold still. And a lot of times that involves rehearsal. And rehearsal is just the concept of giving them an opportunity before a procedure or an intervention happens to learn about what that is and preparation. So these are the steps. For a port access, they're going to come in, they're going to wash it. This is what it looks like, feels like, smells like. Here it is. Touch it. You can feel it, all those things. And then what's the next step? What's the next step? And doing that in a very relaxed, non-threatening way so that the child can then prepare themselves and say, okay, so when I'm getting my port access, I think I want to sit on my mom's lap. I'd like to go to the treatment room. I would like it if I can clean it myself, and they teach me how to do that. And then I want to look away and look at an iPad, whatever that is. And then we use lots of positive reinforcement. And we really try to focus all the reinforcement on concrete actions. So we steer clear of words like brave, which makes a child feel like the next time that they have that same procedure done, that if they're weepy and emotional and they cry or it hurts more, that they're less brave. So we really reinforce, you did a great job breathing, you did a great job holding still, you did a great job crying and telling me that it hurt, any of those things, and really letting them know where they did a good job. I know that was really scary for you. You did a great job letting me know, and you did it. And would it be okay if next time it goes a little bit better because now you're getting to be an expert and we know a system that works. So some children want to be very involved in their care, and I found this great quote in a British study, and it was a 15-year-old patient, and he said, I think sometimes they talk to both of us, but sometimes I find they do just talk to mom, and I'm just, hello, I'm sitting here, especially with consultants. It's just talking to mom, hello. And I think we've seen that with kids a billion times. And so really encouraging kids to speak up for their needs, parents to speak up for their needs, and the medical professionals to be held responsible to providing the kind of communication that your child needs. And in an ideal world, that's something that can happen early on, and say, like, we need you to talk to him, he's the patient, and setting those rules and those standards. Some patients prefer to have their parents as the communication broker, and I really like that term. They want to tell you the information they want, and they want you to go get all the medical information and just give them the pieces that they are looking for. And so sometimes that's a hard role for a parent, because you feel like you're not sure what information to filter out. But usually for families over time, it becomes a little more clear what your kiddo's looking for. Signs and symptoms of poor sibling coping or patient coping. Regression, acting a little bit younger than they are. And then the most clear example of that is, a recently potty trained kid not being potty trained anymore. But as you go up the developmental spectrum, you're also seeing some regression that's totally appropriate. A kid wanting their parent to snuggle in bed that has given that up a few years earlier, they feel crummy and they need that comfort and support. But you want to, if you're seeing long-term regression and changes that feel concerning to you, then that's something to talk about. Consistent and excessive comparisons to siblings, especially to the sick sibling. He gets everything, she gets all she wants, she doesn't have to clean up. How come she doesn't have to go to school? Things like that. Complaints of parents playing favorites. That happens in every family. But if it's consistent and it feels overwhelming or it feels like it's changed over time. Also, looking at psychosomatic complaints. So that's just the idea. And again, some of this is totally normal, but I leave it up to you as an expert to decide if it's excessive and you need help, or if it's a normal amount. And that's kiddos who worry or complain about having symptoms like their brother or sister, or different symptoms, but worrying that, oh, I fell down on my knee and now I'm scared maybe I have cancer. Self-destructive behaviors, obviously a big concern and something you want to act on. And those can vary across the spectrum dramatically. And again, I go back to as parent experts and caregiving experts, you'll know when your child is needing more support. And don't ever be afraid of asking for support early in hopes of staving off bigger changes in needs. Lack of affection for their sibling is something you want to pay attention to, or frequent aggression towards sibling. Again, that happens in families. I don't expect that it disappears magically, but if excuse me, I have the hiccups. If it's anything that's a bigger change. Also, increased disagreements with caregivers and others, eating changes or disorders, sleep changes and disorders, including nightmares. And having an occasional nightmare is okay, but you want to be paying attention. Bedwetting, withdrawal from family, acting out behaviors, and drug and alcohol use are also things you want to pay attention to. So, tips for helping siblings. You want to encourage kids to settle their disagreements. Always easier said than done, but you want to encourage that. And then as much as possible, you want to stay out of the middle of fights and let them solve their problems. And this is hard when you have a sick child in the family, because oftentimes you feel a very different need to protect them from feeling overwhelmed, attacked, picked on by their siblings. But it's best to allow your kiddos to continue to solve their fights. If an argument becomes too loud or overwhelming to you, it's totally okay to step in and still manage as a parent and caregiver, and set limits that feel appropriate to you. And then, as always, try to avoid hitting, name calling, and breaking of things. Stop inappropriate arguing that occurs in public places. Some arguing is totally fine, but if it's reaching a level where you feel uncomfortable, it's okay to step in. Protect individual children's possessions, privacy, and friendship. Avoid showing favoritism. Praise cooperative behavior, and step in early and often as needed. Okay? So, providing verbal support during an event, and by event, I actually mean procedure, and I don't know why I put event. But we want to continue to focus emotionally on supporting a child. Commands to engage in coping during a procedure with strategies versus constant reassurances. So, saying, now take a good breath, take a deep breath, is really so much more helpful than saying, it's okay, I know it's hard. So being really, really concrete about what a child can do to make it better. Studies have shown that that has a much faster, deeper impact than words like, it's okay, I know. And studies have actually shown that when we say things like that, kids don't actually even hear it. They're concerned, they're nervous, they're worried, and those words float right past them. But if we say, remember we talked about taking a deep breath, can you look at me and breathe with me? That changes their brain. It brings their brain back to you and off of their stress and the pain and concerns around the procedure. You want to give information. So using a port access, again, as an example. So we've cleaned it, now we're going to wait a minute, like we talked about in our preparation, and they're getting ready, and it's just going to be 2 more minutes. We're just going to bandage up. It's done, and your needle's in place, and now we just have to put the dressing on, letting them know what's going on. And then again, praise the act or accomplishment rather than the personality or character of the child. You did a great job. You took good deep breaths. You really held still well. I really do often say, thank you so much for yelling so loud and letting me know how hard it is. Carries more weight with the kiddo than you were brave, you were strong, or the opposite end of the spectrum, like you didn't need to cry in that, you had it. So paying good attention to that. We also want to pay attention. I'm not sure what this slide is, but we're going to talk about it anyway because it's here. So we sometimes see behaviors from kiddos that we want to pay attention to in order to continue to promote coping in the family. So sometimes we see anger, and that's a disruption to the entire family. It's okay to be angry at the situation. It's okay to be angry at cancer. It's okay for other kids to feel anger that you have to be at the hospital all the time. But you want to pay attention to how that's being expressed and processed. We can help with the processing of guilt. Oftentimes, siblings blame themselves for brother or sister's diagnosis. Especially younger kids feel like there's a correlation directly to their behaviors. So pretty much every sibling in the world has at some point thought, I wish he'd go away. I wish she would go live with my grandparents, those sorts of things. And then when they get sick, they worry that they caused it. We often see a lot of jealousy because there's a dramatic loss of time spent with caregivers and parents. And they're often encouraged to spend extra time with other adults, and that feels great in the beginning and less great over time. They feel isolated. They're separated from their siblings during medical care. There's a lot of fear, appropriately, of developing same problems, of their sibling dying, of not being able to meet parents. Not being able to meet parents' needs if there is a death. And depression, sadness is normal in a stressful environment, but sometimes it goes deeper, and you want to be attentive to that. Words to promote autonomy and a sense of control in patients and siblings. When instead of if. When you take a deep breath. When I come home. When you say if, it implies that there's a chance those things won't happen. So as parents, it's better to tell siblings at home, when I come home, I'm not sure if it's going to be Friday or Saturday, but when I come home versus if I come home on Friday, and then it's just a little bit more clear. You may wish to instead of I want you to. You might like to take a breath now. It might help. Instead of I want you to take a breath. I need you to take a breath. And then when you, instead of try, and let me know when you're ready. Let me know when you've taken a breath. Let me know when you're ready to hold still. Children often feel a loss of control during an illness. And again, this applies to patients and siblings. Children of all ages want to feel in control of some aspects of their life and their care. Often their control and independence is removed in a medical setting or during a serious diagnosis. And so your goal as caregivers and parents is to find ways to return power to the kid. And sometimes that's about providing appropriate choices. So for a patient, you may focus on things like, we can do this procedure in your room or in the treatment room. Because you can't say, we're not going to do this procedure. And then for kids at home, it's things like, would you like to go visit your brother today or tomorrow? With older children, school-age children, you want to show them their thoughts are important and considered. And again, both patients and siblings. And adolescents, you need to give them a voice and involve them in decision-making. And involving them in decision-making doesn't mean they're making all the decisions, but they're deciding where they feel like they're able to make choices. What if they don't want to know what's going on with them and they don't want to know the details of their situation? You need to ask why. And asking why, you often learn something important that you didn't know. Are they afraid of what they might hear? And if they are, getting them the education and information they need so that they can feel more comfortable with what's coming. Are they protecting you? And again, I talked about that a little bit ago, but that happens oftentimes where patients and siblings don't want to be in a medical conversation because they feel like if they cry, it makes it harder for their parents. Is it too hard to hear the information? And what can we do to help during those hard times? So if their concern is that it's so hard to hear that my counts aren't coming up fast enough, that the doctors are concerned about a relapse or a reoccurrence. Changing that conversation and saying that information is important for you to have, and how can I support you better? And that's both as a parent, but also for me as a child life specialist and for the whole medical team. And then an important note that I've learned from personal experience and also research is just because kids aren't asking questions doesn't mean they're not wondering and wanting to know. So the new normal, back to that, finally. We create a new normal by living one day at a time. Be open to your emotions. Don't be afraid to feel negative and positive emotions. And encourage your kids to do the same. When the adults in a family aren't showing emotions, aren't expressing how difficult something is, kids often feel that their reaction is too much and they try to tame it back. So being able to cry in front of your kids and say, I'm sorry, and this is so hard for all of us, is really important. And then with younger kids, they often feel badly because they don't stay sad all the time and stay sort of mushy and lazy in bed, and that's confusing, and normalizing that is helpful. So also realize that some things are out of your control, and focus on the things you do have control of, and take action on those instead. You can't control that your child has cancer, and you can't change it, and that's really the worst news for any parent or caregiver, is that we can't. And so what can you do that's going to ease this process for you, for your children, and your family and loved ones? Take action to reduce stressors. Chronic stress will not help your situation. It's there already. So what can you minimize, and how can you minimize it? Explore relaxation techniques and stress relief strategies that could include exercise, tai chi, yoga, meditation, expressive writing, or art. There are so many apps available for phones now that are free, that do guided imagery and relaxation. And you can do that, while you're walking out to your car for just a few minutes, if that's going to help. And then there's also research that shows that taking 5 deep breaths has a concrete, immediate impact on your blood pressure. So knowing even things that sometimes feel a little bit cheesy or made up actually can have a big difference. Set aside 30 minutes every day for yourself. And obviously, every day is a dream. But if you can find 30 minutes before your child wakes up to lay on the comfortable window couch or bed or sit in the chair and take deep breaths and answer emails, that can help. And it's a way to bring a little bit of happiness, a little bit of contentment. And even if it can't bring those things, because sometimes it can't, it gives you time to process. And processing, even on the very worst days, helps you be able to handle the things that are coming your way more. And then try something new. If you've always wanted to start an herb garden or grow orchids or take a cooking class, sorry about that. You can do those things, and you can do them in the hospital with your kid. You can try new things, walk up the stairs, exercise differently, anything that you can do. And again, please know that I don't say that lightly. I know how overwhelmed and how exhausting the whole process of having a diagnosis of cancer in the family is. Both treatment, diagnosis, treatment, recovery is exhausting too. I absolutely understand that. But any of these things you can do just gives you a glimpse that there's a world out there that you can still be a part of and reintegrate when times lighten up a little bit. And then how to come out the other side. And I say intentionally, whatever that means, because it means something different for everyone. I think that whether you're a fan of his or not, Lance Armstrong was really the first person I knew of who talked about the difficulties of finishing treatment and how terrifying it was for him, where he'd been getting chemo, and all he wanted was to finish chemo. And the minute chemo ended, he wanted more chemo. How do you know one more dose won't help? Can I have one more dose of chemo? And so coming out the other side means something different to every family. And it also means something different to everybody in the family. And it can change day to day, hour to hour. But thinking about that and even writing it down, taking a piece of poster board and making a poster of the little and big things you want to do after a diagnosis is a great way to continue, again, to get glimpses of things that are coming down the road when things normalize a little bit. Current research related to patients. And this is good news for you guys. Studies show that there are, and I put it in quotes, positive outcomes, meaning some of the effects of chronic illness are viewed culturally as being a good thing. Patients have increased empathy, and siblings have increased empathy, and lower risk of aggressive behavior with peers. There's positives. Positive outcomes include higher, I already said it, higher levels of empathy, social justice awareness, and independence. Siblings of special needs kids and kids with chronic illnesses self-report that they're able to do things more for others after a diagnosis. So one particular study, a child wrote that after his brother was in an accident, he started spending time having lunch with kids who didn't have other people to lunch with him, because the cognitive changes that had happened to his brother as a result of his accident reminded him that everybody was struggling and to reach out to people that didn't. And it started a real movement in his school. So there are positive things. I have big news for you. Look at my big writing. And that is, you guys are already experts. You are an expert before you ever walked in the hospital and before your child ever got diagnosed with cancer. You're an expert on your kiddos. You're an expert on your family, and you're an expert on what you need. And what that means is you know your kids better than anyone else. You have a better sense of what the risks of your kids' diagnoses are in your family, and the likelihood of that diagnosis and how it might impact your friends and family. Have your children changed since diagnosis? And paying attention to that and writing it down if you need to help yourself keep track of if things are starting to feel like it's getting too much. How's their coping changing over time? And letting kids know, I see you doing better. I see you making changes for the positive, or I see you struggling, and I wonder if it might be time to ask somebody to help. How have you changed as a family? And discussing that as a group so that everybody's seeing that as well. Discussing the positives of a diagnosis. And again, that's a hard thing to do, but it exists. I ran a teen and young adult support group here for many, many years. And one of the activities we did at the start of the group each time was an introduction and a positive that had come from your diagnosis. And kids always had them, always. And the thing that was most amazing to me was over the, probably 8 to 10 years that I was running that group, kids would ask each other, would you give it back if you could? And truly never in all those years did a kid say yes. They said, I'd give back aspects of it, but I'm a better person than I was before this diagnosis. I'm stronger. My family's stronger. We love each other a little more. We hold on a little tighter. I learned who I can trust. I lost friends, but I gained better friends who are with me for the long haul. Things like that. So know that talking about that can really normalize the fact that you're still doing okay with what you have to deal with. What about your family culture has gotten stronger? And where do your challenges lie as a family, and how do they show up? And again, saying it out loud gives you permission to know that it's okay and you're doing your best. And I think that's so, so crucial. The most important things that you can do as parents and caregivers is normalize. Let kids be kids in any and every way possible. Don't make them stay in bed if they want to get up. Let them have friends over when they're able. Invite interactions, invite peer relationships. Turn off the TV sometimes and have them read or do art projects. Set limits. So this is a hard one for a lot of folks, and I absolutely understand that because even when my kiddo has a cold, I'm likely to bend the rules. But limit how kids process things and learn is on what they're used to experiencing. And when you have limits in place, and then you take those limits away, and they can yell at you, and they can, sometimes we've seen kids who hit their parents when they're mad during a diagnosis. When you let them get away with behaviors that have never been okay before, that actually increases their fear. And they become more scared of what that means. Why are they letting me do this? This must be worse than I thought. Routines are really important. They hold the things that can be steady when everything else around you feels out of control. So bedtime should stay the same whenever possible. And it's okay to say to the medical team, I can't do a 6 o'clock procedure because my kid goes to bed at 8 o'clock. And if that has to happen, they can say it and tell you why, and you can decide what's best for your family. But sticking to those routines creates normalcy, again, for your kids. And then giving control. Let kids make choices whenever it's possible and real. Contrived choices make kids really mad. So pay attention to that. A contrived choice, an example of that might be offering kids, do you want to do that procedure now or in a minute? That's not a choice. Do you want to do that procedure now or in 15 minutes is a choice? If you can't offer a 15-minute delay because the nurses need to do the procedure now, then come up with a different option for them. So giving choices is really important. Now, just for you, I want you to take some time today, and ideally right now, if you've had the time to watch this video, to think about what you're doing now that works. Because you're doing a lot of things that work. And I know it, and people watching you know it, but you don't always know it. And so if you've got a minute, it might be nice to jot that down. What are you doing that works? And then I want you to think about, what do you need help with? What's not going great? And how can the medical team help? How can your child life specialist help? Social workers, chaplains, and then also your friends and family. People offer assistance, and culturally, we don't do a great job saying yes, please, but finding ways to do that. And what a lot of folks find is websites like Caring Bridge, Meal Train, mylifeline.org. You can ask for help, and it doesn't have to be face-to-face, and sometimes that's really comforting to folks. So think about that, and don't be afraid to ask for help, because what you're dealing with is overwhelming and all-encompassing, and it's okay. So I want to thank you guys for tuning into this. I am available for questions. You can email me at Tommi, Tommi, Tommi.McHugh, MCHUGH, at childrenscolorado.org. Thanks for tuning in and have a great day.